Americans today pay 2 or 3 times more than they probably should for those prescription drugs that folks around the world are paying so much less for.
Well, that was U.S. Secretary of Health and Human Services Xavier Becerra speaking on this morning's exorbitant prescription drug prices on the ABC News Start Here podcast. That interview comes as the Biden administration launches Medicare drug price negotiations with big pharma drug makers to help people access these desperately needed drugs at a lower cost. For the first time in history, the Centers for Medicare and Medicaid Services sent initial offers to drug makers that make 10 prescription drugs widely used by older Americans. So let's bring back our panel here, Mike, John, Alencia, and joining us is our ABC News medical contributor, Dr. Alok Patel. So thank you all for being here. And Dr. Patel, let's start here with you. What could the real-time impact be here for patients who need these prescriptions? And they can cost, for some people, thousands of dollars a year.
They absolutely can. And we have the data, to show us that there are many patients out there, up to 20% of senior citizens, who openly say that they don't take medications as advised. Maybe they're not taking as many doses or they're skipping medications because of the cost. Now, in terms of this actual price negotiation, showing a net impact on these patients, it may be a couple of years, but it's extremely important that we're starting the conversations and there is some transparency. According to the Congressional Budget Office, this could potentially save Medicare $100 billion over 10 years. It remains to be seen how much of that will go towards patient savings, but this is definitely the right step forward when it comes to preventing serious disease such as heart disease, kidney disease, diabetes, and taking care of strokes, which some of these medications on that list you just showed absolutely do.
And John, to you, several drug makers, though, have called this unconstitutional. And to your point, John, the U.S. has the best drugs available, really, in the world. But there is a cost to that. So are you concerned?
Yeah, I'm concerned. Listen, absolutely, we are paying the freight for the rest of the world's lower drug prices. That's just a fact. And we need to help seniors. But let's be realistic here. If we start paying the drug companies less drugs are going to be researched and less cures are going to be out there. So in conjunction with lowering the prices, we need to put pressure on the drug companies to charge more to other countries to level the playing field so they can still continue to have the revenue to do the research. 9 out of every 10 drugs that are researched fail at $1 billion a clip. So it costs them a tremendous amount of money. It's like a baseball player that's batting 50 or 10%. Gets a hit 10% of the time. It's an awful lot of money, so we need to level the playing field and force other countries to pay their fair share.
Yeah, and we're certainly entering uncharted territory here. And Alencia, to you, this apparently is just sort of the tip of the iceberg in terms of what the Biden administration would like to do here, because this idea right now would go into effect in 2026, but then by 2027, 2028, they'd like to have 30 more drugs on the table here to talk about.
Yeah, look, it's something that the Biden administration wants to make sure they're communicating to people because, listen, the reality is medical debt tends to be a top reason that a lot of Americans go into bankruptcy. And so this is a very real issue that seniors, as well as there are young people with disabilities who are on Medicare, they will feel this impact. And so this is something that I think the Biden administration needs to continue to talk about and educate people on because it will be the difference for them and their pocketbook issues that they care about.
Yeah, and Mike, Dr. Patel mentioned it. The Congressional Budget Office says that this program is expected to save Medicare nearly $100 billion over 10 years. How do we ensure that that savings really is passed on to the consumer?
I think you have to hold them accountable. But the reason why I'm smiling so big right now is because I'm excited for this. Elected officials and presidents who sit in that Oval Office are always afraid to go after Big Pharma. They're one of the largest lobbyist organizations that are in D.C. And so the mere fact that they are now getting them to negotiate deals on prescription drugs, this is huge. I was just having a conversation this week with some friends of mine from Canada, and we were just comparing our medical care bills, which you already know what I'm going to say, which is pretty much none for them. And so there was this frustration from all of us who are here in America that of our medical system. And so I think this is the first step. We have a long way to go to reforming healthcare to make it more affordable for the average American. And so for this, I'm actually excited for.
And Dr. Patel, do you want to respond to that? I mean, I do think that, is this money? Is that what you're saying?
That's snapping. That's snapping for the hype of this.
I like it. I like it. So, yeah, but I mean, can you elaborate on what Mike's point is there, that it is a huge step in this country to even be here, to even have these negotiations?
It really is, even to have the transparency of this negotiations, because right now you do have the pharmaceutical industry and the lobbyists saying, hey, this might impact research and development. You have patients every single day asking, why can we not afford medications? Why is it that if we go overseas, we can get the exact same medications for cheaper? And it's really important that we have transparency so people understand this. There's another question that's coming up right now that we've already heard is, why is it that other federally funded programs, federally backed programs such as with the Department of Defense or the VA and the private insurance company, why are they able to negotiate drug prices, but Medicare can't? And so even having this conversation, I think, would give a lot of people some support, knowing that we're doing what we can to lower healthcare prices.
This can be absolutely a game changer,
on top of
especially
that,
for people
I would think it would make it. Oh.
No, Mike, lay it on me.
Sorry, Kana, I was going to say, I think it would actually make it more hawkish, to borrow a word from our previous segment about diplomacy, to what John is saying. I think that will actually force the pharmaceutical companies to force them to raise the price on these other countries that pretty much have universal to free health care. And so I think, John, that is how we can balance it out to make Americans more affordable and then raise the prices for them.
All right, I'm going to leave it to you to figure it out.
That's right.
Head on to Congress, y'all. Mike, John, Linsey, and Dr. Patel, our thanks to all of you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.